Hello and welcome. I'm Professor Julie Davies, Professor of Healthcare Management and Leadership Development at Brunel University of London in the Business School. We have a new medical school and I teach on programs such as the MSc Global Healthcare Management, the Doctorate in Business Administration and PhD programs. Currently have a project on Muslim palliative care nurses in King Faisal Specialist Hospital and Research Centre, Riyadh. I do research on physician leadership and I have a project on AI and well-being amongst healthcare practitioners in England, India and Saudi Arabia. So my key message for this talk is medical educators are central to health system transformation. So it's critical to ask ourselves, what does it mean to build a career and identity as an educator in medicine today? The career path can be quite non-linear, combining clinical, academic, and leadership roles. So identity formation is crucial. Educators grow through community networks and mentorship. They have to be role models for future physicians. And that often entails considerable emotional labor. So well-being is a central concern as educators teach professionalism by example. Educators are knowledge brokers in medicine. So they connect clinical practice, ethics, policy, practice, learning, and design. And clearly, AI is a very important aspect of that for medical educators going forward. So welcome to this session on career development and advancement for medical educators. I hope you find it useful. I think we all know there's a global shortage of healthcare practitioners, including physicians. So what do medical educators do? They're clinicians, teachers, leaders, scholars. They have hybrid roles, and they're absolutely critical for 21st century medical education. So they need to have adaptive expertise responding to complex and uncertain healthcare systems and environments. Increasingly, they need digital literacy to integrate AI, simulation, and e-learning tools for students. And they need emotional intelligence and empathy, sustaining motivation and inclusion amongst young trainee doctors. They also need to be up to date with scholarship, linking educational practice to evidence, which may be confusing and contested, and practice. So we need to look at their career interests. Do they identify purely as clinicians? Clearly not, because they're also educators. What are their experiences of teaching and bringing future physicians and leaders on for succession planning, the next generation? And what is it about their personal situation in a medical school, in a hospital environment? And how do they see themselves as perhaps educators first, clinicians second, or the other way around, researchers, grant holders? So the literature talks about, in this particular example here, BMC Medical Education, the Bertie and Thistlethwaite article on becoming a medical educator talks about motivations. Why would you want to be in this role? Socialization, how you become inducted and internalize what it is to be a medical educator, and how do you navigate through systems. And in their study, they looked at 6 themes. So first of all, why would anyone want to provide a better medical education? Have they noticed mistakes in diagnoses, in gaps in physician, resident and trainee knowledge that they think they can address? What are their own personal goals? Do they want to be full-time educators? Do they want to keep up their clinical practice? And do they want to do research, or do they want to specialize in education? And if so, what kind of innovation and contributions do you want to make? So there are expectations about your self-direction and your self-development. As a medical educator, you need to think of your own role models and how you yourself can be a role model for those newly entering the profession and what it is to socialize and become a physician. And finally, how do you keep yourselves afloat? How do you keep yourself sane and motivated and enthusiastic through your networks, through your personal growth, and what might be potential barriers to pursuing a career within medical education. Let's consider some key questions. So what are the core career routes? Would you focus on teaching and curriculum design? Do you want to focus on assessment and simulation? Or do you want to show research and educational scholarship in the pedagogy of medical education? Or do you want to move into the hierarchy, into faculty development or leadership roles, being an academic dean? And how are you going to keep learning using AI-assisted teaching, interprofessional education, international collaborations and exchanges like fellowships? It's clearly important to build an education portfolio, get feedback on your evaluations from your others and students, and build innovation to keep yourself up to date, and get mentoring yourself as you mentor others. And also you need to negotiate, what you're going to apply for, various fellowships, editorial boards, publications, leadership roles on boards of organizations. So if, like me, you like doing lots of things, how do you manage that portfolio? Or should you become more specialized at certain points in your career? So here are some questions like, how do you balance clinical work, direct patient care, with teaching the next generation and the preparation, which takes a lot of time and emotional energy in the process, research, publishing, and applying for grants, as well as, of course, your family and your personal interests. So I think it's important, number 2, to consider what are your motivations in moving from a full-time clinical practice role to at least a part-time practice role and an educator role. Thirdly, what career transitions have you experienced to date, and which ones do you foresee yourself transitioning through? 4, what are your plans? 5, what is career success to you, objectively and subjectively? 6, how do you spend your time and energy? How do you want to spend your time and energy? And gaps in a kind of coaching model between where you are now and your aspirations. And then obviously you will fill that gap with a personal and professional development plan. It's interesting to look at what the literature says on medical education. I firmly believe that medical education is not a secondary career, but a specialist profession with a deep social purpose. The most effective medical educators are those who combine scholarship and up-to-date practices with compassion. Career success in education depends on community, collaboration, and continuous reflection. And my key message is that medical educators are not just transmitters of knowledge, they are architects of the next generation of physicians who need to demonstrate compassionate care and an understanding of the application and competencies of digital health and AI and so on. The literature tells us that promotion committees value teaching excellence, clinical performance, and scholarship, those 3 aspects. Scholarship needs to demonstrate clear goals, adequate preparation, appropriate methods, significant results, effective presentation, and reflective critique. How do you carve up time for this in your working day and working lives? Clearly, you want to be a good citizen, so you need to contribute to institutional culture and leadership. You also increasingly need to be known outside your organization. So what external reputation do you have and visibility? Are you on LinkedIn? Are you posting on X and other social media, Instagram, TikTok, about what you do as a medical educator? Where are your serious Q1, Q2 journal publications? What about blogs, podcasts? Do you volunteer to mentor others? Are you part of formal mentoring schemes? What exactly do people know about you on social and other forms of media? And I guess typically there are issues for women and other marginalized groups in academic medicine. There may be quite a few people at the lower levels, and we see actually many places in the world more women undergraduates in medical schools than men, but still in leadership positions, in professorial positions, women are often underrepresented. So how do you get into boardrooms? How do you raise your profile so that people see you as a strategic leader and you will get to the more senior positions if that's what you want? A particular aspect that you might like to think of in your career journey and how you craft it is how you gain institutional support. So how, looking at this model, job demands resources, how do you ensure you have sufficient resources to equip you with the demands of the job or the demands you put on yourself? So how do you ensure equity and belonging in your organization? So how do early career medical academics get inducted? Who supports their well-being? What's going on within the teams? And do you genuinely feel that you belong to the profession and your institution? And how can you help other people feel they belong, your colleagues who you can work with? Is there anything in terms of policy, processes, culture, or personal issues that you have faced that you need more support with? You should ask for help with your career. And how have you embedded, this sense of belonging and bringing people on and learning? Inclusivity in your own practices and decision making. So are you included in the boardroom? Are you included in curriculum design? How could that be improved? Do you need a coach? So how are you supported, and how do you support others who in turn may support you in your career? And career progression means different things to different people at different life stages. So for some it's merely getting to the top quickly. It's about rapid promotions and you may need to move geographically. For others it's a high salary. Some people want their career to take off after their kids have gone to secondary school, for instance. Increasingly, Generation Z wants a good work-life balance. Others measure their success by their H index, how well cited are you, or by the number of likes on LinkedIn or in podcasts, or by the size of the grants that they have, or the number of international collaborators, or do they have any patents? Have you engaged in entrepreneurship and are you a member of boards? Or do you really enjoy working with engineers and different kinds of people, the medical school, the business school, other parts of the university sector, as well as private industry? So you kind of need to decide what a successful career looks like subjectively for you, but obviously there are KPIs and there are key measures like positive student feedback and positive responses from your colleagues. Opportunity ability model is quite useful to help you understand. At one time you might have been highly motivated but not very capable because you were new. Now you're very capable but less motivated because you've been doing something many times. And you may see few opportunities to showcase, your successes. So how can you make sure all of these are high, motivation, ability, and opportunity, and you keep yourself up to date and enthusiastic without burning out? In any career process, it's useful to get reflections. So what's happened in the past year? What have been your key achievements, your key failures, your learning from these failures and achievements? How would you assess your own performance review by looking in the mirror backwards? So how have you done in terms of teaching, learning, and student experience in medical education? What has been your impact on others and practice and research? So we've done some research on palliative care nurses in Saudi Arabia, and the direct impact is now that they have a supervisory program for these nurses to help understand the stresses of the role and how we can make them stay. What kind of leadership, voluntarily or formal, have you taken? What have you managed? How have you supported the culture of the organization and collegiality and general collaboration? What external impact and markers of esteem have you developed? Do you chair committees? Are you on editorial boards? Are you on management boards? And what learning have you undertaken in terms of, for example, AI literacy in medicine? And although medical education is about clinical practice, ultimately it has to be about people, their values, how they understand meaning, their roles, support for each other, and context. So it's important in your career to think of Which parts of your work give you the greatest source of purpose or energy? What are your strengths? You might want to play to your strengths rather than compensate for your weaknesses. So how can we have a strengths-based approach and improve on your strengths? And how can you do that individually and with the team? There may be issues about workloads that you need to negotiate, particular requests for development to do or to stop do or to start. Do ask, because if you don't ask, you don't get, even though things may be tight in terms of student load, clinical load, teaching load. Line managers are very important. So what dialogue are you having with your line manager to support you better in your role and the changes over time to make you stay motivated? And obviously up to date with compliance requests. Are you taking enough annual leave and breaks? Are you working too much in the evenings and weekends and holidays? And is there any feedback, useful feedback, that you've received that you would like to process with a coach or a line manager or a colleague that you need to take time out to do? There is this saying that if you fail to plan, you plan to fail. So you need to think through what is it of these various aspects like teaching, learning and student experience in medical education, or research, professional practice, leadership, management, external engagement and reputation building, belonging, well-being and collegiality do you need to focus on to get you to the next stage? How will you motivate yourself? Who will you commit to doing this with or for? Or to tell somebody, that you will regularly reporting, who will you be accountable to see through your plans? Obviously, at the same time, remaining, alert to dynamic changing circumstances. And first and foremost, if you are the backbone of healthcare systems in terms of the future of medical education and physicians, how are you going to ensure your own well-being? So there's this model of 8 dimensions of wellness for yourselves, for your students, for the teams you work in. And we are social animals. So what is the social aspect of your working life? How are you going to maintain your own physical well-being while ensuring, others are looked after? What about your intellectual growth, your emotional labor, personal finances? Do you spend time in nature? What is it about your environment that is helping your wellness? What is helping you within the workplace, spiritual and other needs? So put yourselves first, and then you can, by supporting yourself, you can support medical students and the future of the profession. To grow and to be up to date, we need to embrace changes, but also keep what's valuable. And have a growth mindset in terms of personal, professional and personal development. So I would advise that in advancing anyone's career, particularly in medicine, it's important to sustain your connections and keep developing new connections, build your confidence, competence and continuous professional development and well-being so that you help yourself and you also help others. Thank you very much for listening to this session on career development and advancement for medical educators. I wish you good luck with your plans.